Welcome to today's video where we'll be talking about medical experimentation. Now, when I think of medical experimentation, I think of an evil scientist wearing a white lab coat trying to inject me with some strange substance. And you'd be surprised, but that's not entirely often the truth. Medical experimentation at its core is using the scientific method on humans in order to observe and understand how the body works on a biological level. Researchers typically induce a change on the subject under controlled conditions, and they make observations and collect data. Then they analyze the results with the hope of either helping the subject or advancing medical knowledge. Now, as you can imagine, there's a lot of moral and ethical considerations when it comes to experimenting on another human being and risking an abuse of power from doctors and researchers. Medicine used to look very different compared to today's standards. In colonial America, most medical knowledge came from Europe, and physicians would come to the colonies to practice. But even then, it was few and far in between, having to go out of your way to find a doctor. There were no widespread laws or standards for medicine, and many physicians did not have any formal education whatsoever. There were no laws regarding consent, and it wasn't seen as unethical to try a new or untested treatment, even if the outcome was lethal. After gaining independence, laws started to pass in America requiring that doctors at least be educated in order to treat your bumps and bruises. Alright, it's pretty obvious going into the 1800s, physicians had barely any idea what they were doing. In fact, they didn't have much knowledge about things like diseases at all, and their treatments were based on really bad and incorrect conclusions. Common treatments included bloodletting, purging, cold water dousing, and often depended on things like the weather, the moon cycle, and the environment. Real scientific, huh? This time marks the beginning of emphasizing observation, and American scientists started experimenting with new herbs and drugs for cures after realizing that maybe bloodletting isn't the solution to everything. Medicine had to be experimental in this time period because people just didn't know that much about how the world worked. This often meant ineffective and invasive surgeries and treatments that resulted in dire situations for the patients, especially on patients who weren't fortunate enough to be a rich white male. Specifically, black slaves suffered the most from medical experiments, as medical doctors exploited African American bodies for research since they were legally invisible. They were seen as less than human and were often at the complete mercy of their owners and white doctors. Doctors even bought slaves for the sole purpose of experimenting on them. They were practically tortured and had to endure extreme bodily pain for the sake of research. One famous incident was when Dr. James Sims, also known as the father of gynecology, did experimental surgeries on enslaved women until he perfected his technique to repair injuries during childbirth. There was no such thing as pain relief or anesthesia during surgery, which meant these women were awake every excruciating minute. These people had no say in what happened in their bodies, but it was ultimately because of them that medical research could advance and help others in the future. Late into the 1800s, there were still no laws about the ethics of medical experimentation, but it was not required by law to ask for consent from patients or explain to them the purpose or details about their treatment. Most just wanted to follow doctors' orders, and they trusted them with their lives, meaning doctors had free range to prescribe what they thought was best for their patients. Going into the 20th century, ethical considerations were not standard practice. Many researchers took advantage of the poor, inmates, insane asylum patients, African Americans, immigrants, and orphans. They were susceptible to unethical treatment due to their perceived ignorance and biases against them from the white scientists. Researchers argued that these experiments were necessary to advance medical knowledge, and laws were never passed because physicians declared them unnecessary and impediment to future research. World War II was the turning point in medical science. The atrocious Nazi experiments and Nuremberg trials sparked lots of discussion in the research community about ethics, and many sought out rights to protect those involved. The Nuremberg Code was enacted in 1947, mandating voluntary consent for research studies on humans. However, this is not law and it was not legally binding. Many researchers didn't know about this code of ethics, and it was not widely followed, believing that it only applied to German physicians. American doctors thought that the Nuremberg Code was too restrictive to scientific progress and would find ethical loopholes to pursue their own goals. By the mid-20th century, doctors were injecting patients with polio, tuberculosis, radiation, and cancer, as well as subjecting participants to powerful drugs, acids, and solvents with little to no informed consent. Prisoners were subjected to the worst of these experiments since they were easily bought off, widely available, and confined to one space. It wasn't until the 70s that there was widespread criticism of doctors, suggesting that they were behaving like the Nazis did during World War II. It was in this decade that the Tuskegee syphilis experiment was exposed to the public, where 600 black men and their families were deceived into participating in a research study that denied them treatment of syphilis in order to trace the progress of the disease in African Americans. This inspired public outrage, and the study was terminated. Legislation was soon enacted as a result of experiments like this, requiring that human subjects have written informed consent for their participation, and enacted institutional review boards to evaluate studies and ensure protection for the research participants. It is clear that ethical principles and morals have evolved over time to where they are today. In modern medicine, ethics require respect for the research participant, urging experiments to be minimally invasive and cause little to no harm. Patients are required to understand and give informed consent before research is done, and they are allowed to withdraw at any time. There must be no deception, and researchers must use clear and simple language explaining the benefits and risks of participation. It was around the 90s that medical professionals started using phrases like clinical trial or research study instead of human experimentation because of the negative associations that come with it. Experimental research will try to hide the fact that it is experimental to not scare patients away, giving the participant a false impression of what is really happening. Some professionals believe that it is every citizen's moral obligation to enroll in research studies for the progression of science, but others tend to exclude minorities to protect them, limiting research on health needs of marginalized groups. There is no agency that tracks the deaths or injuries that have come from medical experimentation, meaning that we have no idea if research has become safer or more dangerous in the modern world. Medical scandals have not been eliminated, and there have been many documented cases where researchers were too scared to express concerns about an institution's practices. Whistleblowers are people who expose unethical behavior within organizations, but it comes with a lot of moral conflict within a person. On one hand, they wish to do the right thing and put a stop to unethical research practices, but on the other, they have personal risk like losing a job, status, and credibility. Institutions want to protect their image over honesty and accountability, and many fear to speak out against authority. There appears to be a maniacal impulse among academic physicians throughout time to publish research for promotion, often forgetting that their subjects are human. This becomes dangerous when they see their subjects as purely experimental materials, but this mindset isn't entirely their fault. Medical training can erode an individual's natural moral response to suffering, and they are taught that conformity, hierarchy, and an institutional's interest are a top priority. This can make it difficult for professionals to recognize or act against wrongdoing. While we tend to put a lot of faith and trust into doctors, they're human too and are susceptible to biases and ulterior motives, and they have historically put research subjects at extreme risk. We have evolved to an age of science and technology where we have an abundance of evidence for treatments to common ailments. We no longer have to fear untested medical practices due to the protections in place requiring doctors to inform us what we're getting into. But it's not always guaranteed. The history of medical malpractice encourages patients to stand up for their bodily autonomy and make informed decisions on what is best for them, not for science. Science will find a way to progress despite what physicians believe. And there is hope in the future for better medical practices and controlled experimentation. Thank you so much for watching. I hope you enjoyed and maybe even learned something in today's video.